I'm incredibly pleased to be joined by Dr. Medhat Abbas. He is the Director General of Gaza's Health Ministry. Dr. Abbas, welcome to the Freedom Side.
You must welcome. You must welcome.
So we are speaking to you. You're in Gaza right now. The situation is very dire. We're hearing the hospitals are running out of fuel as the Israelis have cut off fuel and access as well to medicine and food. Can you update us on the casualty count in Gaza as it stands right now, as well as the situation you're dealing with across the Gaza Strip?
Well, 5,300 are injured, and those 1,100 killed within those 5 days of the crisis. As you mentioned, the Israelis declared that decided to cut the electricity from the first day. So we were relying on the only power plant of Gaza Strip, which has stopped today. So right now we have no electricity at all.
Wow.
We are relying on standby generators in our hospitals, and the fuel that we have today in the hospitals is enough only to run those hospitals for 2 days, not more. So now the borders are sealed, so we cannot buy any fuel by all the means because the borders are sealed. They have not only closed for the fuel, but nothing is getting inside Gaza. This is including also potable water. They shut the water, and also we do not have access for food. They are not allowing food to come into Gaza. The only solution today for this crisis is to open a humanitarian corridor for the patients to go outside to be treated, and for the health professionals from outside to come and extend a helping hand to our colleagues in the hospitals. The other problem that we have today is the 300,000 displaced persons coming from those whose houses are bombarded or were under heavy strikes. So they were forced to leave their homes, and they are now in schools considered as shelters. But of course, the capacity of those schools was to handle only 120,000. Today they have three times their original number. So the UN declares that they cannot handle this number anymore without having additional resources. Resources, of course, nothing can get inside Gaza. Well, the other problem is attacking the health facilities by the Israelis. In fact, they have attacked Nasser Hospital. They attacked one of the ambulance, the premises of Nasser Hospital, which is based in Khan Yunis city, southern provinces of the Gaza Strip. And also they have attacked the Indonesia hospital, and they have also stopped the services provided in Beit Hanun city because they have annihilated most of the city quarters. And now this hospital is out of service. Let me say that 20 ambulances were directly attacked during this war, and many of my colleagues were killed, unfortunately. So the situation is there's no safe place in Gaza Strip for the people to stay in. The civilians, of course, who are under fire along the hour. In fact, we have the warplanes in our skies 24 hours a day, and of course they are chilling sometimes randomly. Sometimes they threaten the people to evacuate, and sometimes not. You may find the people killed while they are inside their houses, and of course under the rebels you try to evacuate or to save those who are under the rebels, but we do not have enough equipment for the civil defense people, so the people go try to save the victims by their bare hands. I think the situation is very miserable, and without having this humanitarian corridor opened at once, I think the health system for sure will collapse, as we have no extra beds now to treat patients, and the patients are the wounded are lying on the corridors of the emergency hospitals in most of the emergency departments in Gaza.
Wow, that does sound incredibly dire. And, we've had you on this program before in the past when Gaza's been under bombardment. And it has always sounded dire, but there does seem to be, because of just the severity of this particular added siege on top of the siege, where Israel's not allowing anything in, bombed even the Rafah crossing. It seems worse than past instances of these bombing campaigns. Am I correct to say that? Is it worse this time around?
Yeah, this is much worse than any of the previous wars against Gaza. Yeah, this is the wars. And now they're waving by another land operation. I don't know what would be the goal of that, as they have already destroyed the entire blocks of Gaza Strip, Gaza City. I mean, what are they going to do inside Gaza? I don't know what are the goals exactly, because nothing left, nothing has remained already. I mean, Gaza City is not a city anymore. Gaza was a city once upon a time. Today, it's just become some rubbles, nothing more.
I wanted to ask you also. I want people to understand that even before this recent bombing campaign, Gaza's been under siege for 15 or more years now, and has already been dealing with issues in the health sector, including lack of medications, inability to update equipment, or even having lacking in equipment. Of course, there's also, not exactly like a plethora of every specialty available. And Israel in the past has actually bombed some of the most educated health professionals in the country and killed them. So, can you paint a picture for our audience of what Gaza was dealing with even before this latest bombing campaign in terms of its capacity in the healthcare sector?
Well, we have had shortage of medications by 40% of the essential drug list, and 32% of the medical supplies, and shortage of 60% of the reagents required to operate the laboratories of the hospitals. And of course, the borders were not that great for patients to travel outside, as many patients were not allowed to travel outside through Erez Junction, where they should go to the West Bank or the Israeli hospitals or even Jordan. But sometimes many apply, and under the claim of bending, they have no permit, and they cannot stay. And many of them have already succumbed to their destinies, and they died inside Gaza with avoidable complications that would have been treated if they were allowed to travel. And of course, it's not only one war that we have, but we have had many escalations before. Of course, adding too much pressure on the infrastructure of the city within Gaza Strip, and leaving the poverty prevailing and the unemployment prevailing, with a very collapsing economy, with like 80% of the community relying on free food tickets prior to this escalation. Today, they are saying it's said that the situation will be much more worse. Yeah. So, I mean, without extending a helping hand to our people, I think there will be a immediate collapse that will be witnessed soon. People will not be able to find food or potable water. I mean, that would be another additional disaster in Gaza.
And Dr. Abbas, can you give us an idea of what the situation is currently in terms of the kinds of injuries that are being seen in the hospitals, for example, for people who
the
are
people
even,
arrive to the
go ahead.
hospital totally. The people, when they arrive to the hospitals, they're totally disfigured. I mean, some of them are having amputations, some of them are having massive injuries, some of them are decapitated already, some of them are burned, so you cannot recognize their features. So, because those F-16, when they attack the buildings, I mean, the buildings collapse and the people are inside. Many of those buildings were attacked without any threat before to evacuate. So the people, when they go to the hospital, they are in very critical condition, which is explaining why we have more than 1,000 killed within 5 days.
And there's also been reports of the use of white phosphorus, which I know the Israelis have used in Gaza in the past. Is that the case, or are there injuries from white phosphorus that are being seen now? And if so, could you explain what that injury entails?
Yeah, when the patients arrived, many of them were burned, but I don't know whether it was phosphorus or not. I'm not having experience to judge this, but many of them were burned. I don't know, is that because of the explosions or that because of certain phosphorus? I don't know. I cannot say.
And in terms of the kinds of people who are coming in, are you seeing? There's been reports of 260 dead children having been killed in these Israeli airstrikes. So in Gaza, of course, is over 50%. Under the age of, I think, 18, if I'm not mistaken. It's a very young population. So what is the age range of the kinds of people who are being brought in injured from these airstrikes?
Yeah, but not less than 30% are already children. As you mentioned, we have 50% of our population are children, and 50% of the population are females. So yes, and it's highly dense population, Gaza Strip. It's the highest in the world. So wherever they attack, I mean, there will certainly be some civilians here or there. I mean, there is no empty areas in Gaza Strip. It's full of people. and the people are overcrowded within their homes and within their areas. So wherever they attack one house, even to target those living in this house, all the neighbors will have their share of death and injuries.
And Dr. Abbas, another thing I'm curious if you could elaborate on a bit. You mentioned earlier when you were speaking about attacks on medical facilities, and I believe I saw reports today about attacks on paramedics. So, on top of course, the very difficult circumstances that the health sector is having to operate in, it's also under attack itself. Could you talk a bit about that?
Well, in fact, that's not the first time. I mean, I remember
Mhm.
a hospital which we call El Wafa Hospital. I remember one day I was the medical director of that hospital, and I was called midnight to see. Usually, when you have a call at midnight in a hospital, usually you think of a patient who is suffering and you want to save his life. But the surprise was that in a room with two patients, paralyzed patients. Two of the nurses were trying to save them, not to save, let me say, because they will develop bed sores without, I mean, mobilizing them in their beds. So the nurses, two of the nurses were getting inside the room with two beds, is the patient inside this room. They received one bullet. They were shot by one bullet that penetrated the heart of the first one and stayed in the heart of the second nurse. It killed both of them. One of them is Lobbat, the other them is Abdul Karim, and both of them have died inside the room of the patients. So they were inside the hospital. They were assassinated inside the hospital. So that's what we used to see from the Israelis regarding dealing with the health facilities. This is not the first time. I remember in the last wars that they have attacked a hospital called Al-Aqsa Mater Hospital. This hospital. I was the director of that hospital that day, and the situation was very miserable. The doctors were not able to access the hospital, and I left the hospital to another general hospital to bring extra staff. In the way, I hear the people saying, "Oh, congratulations, Medhat, you make it. You're still alive." I said, "What happened?" They attacked the hospital when I left it, and almost 70 were wounded, and 3 of my colleagues were killed inside the hospital that day. So we used to see, and they have attacked the Wafa Rehabilitation Hospital one day, totally annihilating the hospital and level it on the ground. So that's not the first time when they attack ambulances or they attack health facilities, which is, of course, I don't want to say this is against all the international laws or international humanitarian law. These are war crimes, and they have never ever brought to justice. They have never ever held accountable for those crimes that they commit against our people. That's why they keep doing the same crimes and the same crimes. That's the situation in Gaza, and we have been seeing that for the last 20 years, not 1 or 2 years.
And you mentioned how this time there needs to be, you're talking about the need for a humanitarian corridor, as well as because the needs in Gaza are just so immense that it can't even be fulfilled under these circumstances. If this continues, if this current level of siege behavior by the Israelis, where they're not allowing in fuel and they're not allowing in medicine and they're not allowing in food, if this continues, tomorrow, the next day, the day after, how, like, give me an idea of how bad the situation will get if there isn't some sort of
Death,
intervention to allow
death will
access
be
to
in
Gaza.
thousands every day. The death toll will raise to thousands every day, and the community will collapse, not only the health system. I assure you.
Like, what else beyond the health system?
Corridor, humanitarian corridor should be open right now. This war should stop right now, and we should have the requirements of the humanitarian requirements of the people together immediately. Otherwise, we will have a very bad disaster occurring in the Gaza community.
Is there anywhere, do you feel there's anywhere safe in Gaza right now?
Well, just if we leave the Israelis to commit the same crimes when they're supported by President Biden, if this tragedy is stopping, I think we will witness civilians dying in Gaza, and that's not what they deserve. In fact, I assure you, and I assure Mr. Biden that all dying today are children and women. So, and I think he has only seen half of the picture, but he has not seen the Palestinian part of the story. He has not seen a picture. He has not heard from us. He heard only from one side and took his decision. I think this is unfair, and this will be responsible directly to kill more more in Palestine.
And Dr. Abbas, lastly, what is, if there's one thing that the people who are watching this program remember from what you're saying, like what's your ultimate main message for our mostly Western audience to hear from Gaza from a medical professional?
Just do something to save Palestine. Do something to save Gaza. Go to the streets. Go to your governments. Explain to them that there are people dying here who have done nothing in this life except that they want to live free on their land. Not occupy, our land is occupied. The people are defending themselves to have dignity. We have no airport. We have no harbor. We have no access. We cannot travel easily. We have poverty, prevailing poverty. I think this is enough. We have been under siege for 20 years. It is time to enough. We need everybody who can help us through the media, through pressurizing, through lobbying to their government, stop the Israelis committing those crimes and to let Palestine be free. I think this is my message for today.
Dr. Abbas, I want to thank you for joining us.
You must welcome. You must welcome every time. Thank you.